My dad's a doctor, and so I followed him on Saturday morning. That was my time with Dad, was to go to the hospital and don my little stethoscope and pretend I was a doctor. I was convinced that patients thought I was a doctor at the age of 8. So that's where it kind of got started. It's watching my dad and how he interacted with people and the connections he made really inspired me to join the field. So the philosophy of the medicine that I practice really focuses on preventative health. So making sure that we stop diseases before they start, making sure that we prevent recurring diseases. But I think getting to know the person as a whole, meaning where do they live? Who are they living with? What's their family situation like? What are their struggles on a daily basis? And knowing those social things can help really take care of someone in a comprehensive way. I think what makes me unique as a doctor is the way I approach walking into a patient's room. I focus on taking care of that patient as if they were my own. If they were my own mother, my own sister, my own child, what I would want for someone that I love. And I think that medicine isn't black and white. The questions that they have, there's not always a right or a wrong answer, and making sure that we find the right answer for that patient. And that might take some negotiation. Education is a cornerstone of medicine. You can't practice medicine without being an educator. And I like to find those little moments in the middle of a visit that are going to provide some insight for the patient into their disease or some background into what's going on with them. And that can be while we're having a conversation. That might be me ripping my stethoscope out of my ears and having a moment of education right then and there. My joy in life comes from my kids. I have 2 little kids, so being a mom at home is a big part of my day. My joy in medicine comes from my patients. No matter how old they are, they're my kids at work.